Hey everybody, welcome to my hands-on tutorial on skin rolling. Now, skin rolling with most therapists who know how to do it, it's either used as a diagnostic to evaluate and assess tissue, but it's also a therapeutic technique to stimulate the superficial and deep layers. With my clients who have had a surgery or who have scars in their body, I usually use skin rolling to identify and treat areas of restriction or what's called abnormal cross-linking of fascia, where the tissue has gotten a little tacked down in areas where it shouldn't be adhered to. And that can oftentimes happen because of a scar, but it can also happen because of excess fat in the superficial fascia. Now remember, when connective tissue is hydrated, it's pliable and supple, and it supports, protects, and stabilizes everything, helps us with our immune system, it improves fluid flow throughout the body, and it also helps us with circulation and cellular transportation and waste elimination. But fascia also helps the body to resist mechanical stresses. So when trauma, infection, or surgery or inflammation occur in any area of the body, fascia can actually lose its pliability, almost become stiff or sticky, and that's what actually causes those abnormal links in the collagen bindings. So under a microscope, connective tissue should kind of look like a spider's web, but if you have adhesions, it kind of looks like a cobweb. And when collagen gets tacked down, that can reduce your motion, it can cause pain, and again, kind of adhere to tissue that it shouldn't in those deeper layers, and that can really cause damage to the overall texture and mobility of everything from your skin to your muscles and your bones. That can reduce your immune system, and it can decrease lymphatic flow, and just kind of impedes on your everyday efficiency. So skin rolling can actually improve those abnormal crosslinks in those collagen bindings, and that can give collagen synthesis a little bit of a boost by bringing new fluid flow to the collagen matrix, which is also known as fascia. So let me demonstrate on a friend what skin rolling really looks like, and then I'll teach you how to do it to yourself to show you how that's also possible. But personally, I think this is a great thing for couples to do to each other, cellulite or not. Now, one more thing. When you do skin rolling, you might find that the first 2 or 3 passes are pretty intense, because that's kind of what it feels like when tissue is stiff. It kind of increases the reaction of the free nerve endings found in your fascia. But you're going to do 5, 6, or even 7 passes in every area, and that will really actually make it feel like it eases up. So if as you're doing the treatments, you actually feel through each pass it's getting a little bit easier to tolerate, you're actually sensing that instantaneous fluid flow and restoration of the collagen bindings. And again, if you have excess adipose tissue or fat tissue in your superficial fascia, it is going to be tender and intense, but it can also help to smooth out your backside by just gently stimulating the fluid flow in the connective tissue system. So let me show you how this is done, and I hope you enjoy skin rolling. Hey everybody, welcome to today's hands-on tutorial, which is on skin rolling. I'm going to show you how you can do it on yourself, and then I'll also show it to you when I do it to a friend, which always makes it feel much better. But one of the things I really want you to do is use your own hands as palpation tools. So as you're doing the skin rolling, if you feel kind of like a crunchy sensation, like you got little Rice Krispies in there, you are feeling that collagen binding, and how fat and collagen don't necessarily always play nice with each other and can cause some of that rippling effect on your tissue. Now I'm going to show it to you on my legs as well as on my belly. For those of you who have had a baby and you're kind of talking about that little bit of pocket of tissue that's left behind, remember, when skin overstretches, the elastin in fascia usually is what breaks down, and that's what kind of makes the skin look a little more soft and buttery. But still, if you feel like that's also collecting some fatty depositions, I'll teach you how to do that skin rolling on your belly to also make a change in your abdomen. So let's take a look at the leg first. Okay, so what you're going to do is straighten out your leg, but you want to make sure that your tissue feels loose. So kind of look at how I can kind of shake my leg. I want to make sure that it kind of feels loose. So, you know, like I don't want to tense up my muscles. I actually am trying to bellow through or undertow all of the tissue from my skin up to the top of my thigh. So I want you to see how I actually grab the tissue. Can you kind of see how I kind of have a pinch of it? And then what I'm doing is I'm actually backpedaling. So I'm rolling under as I'm pulling up. And that's what's going to give me the actual treatment itself, is the roll upward. And again, a lot of you guys are going to find in some of these areas it's really tender to do this. So slow down, and what I want you to feel for are these little crunchies, these little grindy pieces of tissue, and that is where the collagen has actually bound itself down and how fat kind of collects in there. And you like really kind of see how you can sort of settle it in all the way up to your thigh, and you can go over every square inch of your legs. So if you want to work on your belly, and what you do is same thing, is you start at the underside and you just start to peel up the skin. You just work upward, all the way up, 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 up as far as you can go. And that's the easiest way to create a little stimulation in that superficial fascial tissue all around your belly. So let me show you how you can do skin rolling while you're lying on the roller doing some of the lower body length sequences. I actually do these on the roller myself, so I find that this is pretty beneficial. So let me show you how to do this. So you're going to lie on the roller. And what's nice about when you are on the roller is that your tissue can become more slackened, right? So if I've got that roller under my hips, while I'm here, now if I bend my knee, what is that going to do to my tissue? It's going to tense it, right? So if you just straighten your leg out, and now again, what's nice about this is that all of my tissue is nice and soft, like even on the back side. So now I can really grab that tissue and I can create that skin rolling. And it's just a little bit easier to do, I think, when I lie down. And I also just like to have my legs up. I feel like it pulls some of that swelling out of my legs after a long day of work. And again, you just kind of pull it inward. Now I work upward because it's easier for my hands to grab it, but there's nothing to say that you couldn't then work down the tissue as well if you want to kind of pull and pry it in different directions. And same thing on the back of your leg. If you soften your legs a little bit, right? If I slacken it, now I am going to have a little bit more of that ability to roll my tissue. And so on the sides of my leg, I just sort of bundle it and roll. And just try to get into that tissue just by backpedaling the tissue in and out. And you can sort of see how that sort of crimps and pries the tissue that's fatty under my skin, and that's just as easy as it is. That's just a quick one. Now on my belly, same thing. What I like to do is really slacken my abdomen. So if I have my hips up, that's really going to soften my belly. So now if I want to get into my belly tissue, I could just slacken my belly, and now I've got really all this nice soft tissue to work with all the way down as low as I want. And then same thing, I'm just going to let my belly go soft, and I'm just going to create a little bit of skin rolling. Again, backpedaling the tissue, grabbing onto it, and then spinning it backward. And you might find that right around the navel, it's a little bit thick, which is not uncommon because we have this thing called an umbilicus. And so the tissue right in the middle should actually have some thickening to it. However, after having babies and postpartum, oftentimes this tissue can become awfully stretched out and can cause a diastasis, or a splitting of the deeper layers of fascia. So again, you could even just take the tissue here and just pinch and twist it. But again, if you can grab and then pull and roll, you'll always get a better resolve in the tissue. So that's all it takes to twist your tissue and stimulate the superficial fascia where fat loves to live in those multi-microvascular spaces. You can actually help to stimulate and wake up those collagen bindings, and also help to redistribute some of that unnecessary fat that lives in your superficial fascia. So give skin rolling a try. Happy melting.